overview. We'd like to now call upon Dr. Upsham Goel sir for his talk on getting the best out of your phaco system. AV team, can you please switch on their slides?
So good morning, everyone. So my talk is going to be very short and I hope sweet. So yeah. So more than my speaking on the things, rather than audience taking the notes, I would want you to tell me what do you want out of your phaco system. बताइए साहब, क्या चाहते हैं? What do you want out of your phaco system? One, of course, it should be inexpensive. It shouldn't be too expensive. It shouldn't break the bank. That's the first thing, obviously. And what else? Come on, I see a lot of young people here. Tell me. What do you want? You want reliability? Right? We want cost of acquisition. We want reliability in terms of our machine and in terms of services. That's all fine. And we want a machine which really works in a controlled manner for us. Right? What do you think are the controlling factors? All of you people must have already used phacos at some time or the other. Can you tell me what do you find is the troubling point in your phaco? Because that is the point where we will start discussing all this. Tell me. Come on. Okay. No one. So let's start from the very basic. One is your foot pedal, right? You want your foot pedal to be programmable. You want that it should be able to respond as per your needs. In the beginning, you are a slower surgeon, and as you progress, you become a faster surgeon. Is it not? So that's what you want. So a programmable foot switch is one in which the foot switch can be programmed to later on change the parameters. Okay. So I'll typically be talking on this video, which has been made is based on the Hummingbird machine, which is, as you know, an auto machine. And so Hummingbird, yeah. So that's the one we are going to look at. Now I'm going to show you a video of a really, really hard cataract, because that is where you really test a good machine. Simple cataracts anyone can do. So as you see, what is happening? So once you start your phaco, in the beginning you want a high vacuum to hold on to your nucleus, is it not? But you don't want surge. So you want your aspiration rate to either be automatic or to be linear, right? So that's exactly what I'm trying to show here. So we are using a phaco power of 45, and the pulses per second are only 15 pulses per second, which is going to save you a lot of phaco energy versus a continuous. So continuous is, let's say in 1 second you fire the phaco, you at 100% power, then you are getting one second of phaco time, right? Whereas if you're using let's say a phaco of 45%, then if you fire for 1 second, you get only 45% of the phaco power. But if you are dividing into 15 pulses, let's say one pulse is 100 milliseconds, right? And if you divide in, let's say you take 10 pulses, so you are reducing 90% off 10% on time. So you are able to decrease the actual power used to less than 1/10 of the actual power. You need a good vacuum, certainly. So we are looking at vacuums of 300 plus at least. But again, at that high vacuum, we do not want too much fluid to come in. Now there are companies which have worked around this. Some have increased the bottle height. Some have increased the thickness of the tubing. Some have increased the pressure through which the fluid is delivered, right? So you have plates which press, and as you keep on going higher in vacuum, the plates keep pressing harder, and the cost keeps going up. So what we want is that if we have a vacuum which is fixed, then we are looking at a flow rate which should be linear, because that should be linearly rising, and the machine should be able to respond very well. So we require a tubing which is thick enough, because normal tubing aap use karte ho, that is thin. So it does not deliver enough fluid. The bottle is there, the height is there, fluid is coming at high pressure, but it is not coming at fast enough volume, and we want it to come at fast volume. So here in the Hummingbird, we have a dedicated drip set, which comes with the machine, which has a fairly large lumen. So that's an advantage. You would know, so as you increase the square surface area size, So if you make the surface area double, the fluid will increase by 4 times. right? So here we are. So this is what we are doing. Now you see the vacuum is 300 and the flow rate has dropped to 0. And as soon as there is an occlusion, the vacuum is maxed out, the flow rate has dropped. And here you can see it works in milliseconds. The moment the vacuum is dropped, the flow rate is going to go up again. And that's what gives you good followability and controllability. So that's something very, very important, that these are the parameters you should know, and just putting it on the machine is not enough. You should actually see how well the machine is performing. That's why I tell every new buyer of a phaco machine, please take a trial. Don't just go by what is being claimed. Go by the trial of the machine, see whether it is responding good enough. Like when I took the Hummingbird, typically it is pre-programmed at 60% the foot pedal. So from 60% starts firing, and then as you keep going down, it'll still on a linear setting, it'll keep on increasing the aspiration or the vacuum depending on what you've put on linear. But I didn't find it fast enough, so I got to reprogram. So now they programmed it at 70%. So at 70%, it starts firing when the vacuum has built up to a fairly large extent. So this is what I meant by a programmable system. So again, as you can see now, so as soon as he gets an occlusion, the flow rate is 32 now. And again, that you can see that here the sound, which you can probably hear here. So as soon as you get your occlusion, the vacuum goes and the flow rate goes down. This is happening very quickly, very fast, and that is what is ideal for a machine. Now most of your hard nucleus is getting eaten away, and at a phaco power of just 35%, imagine. And the actual power you can see here, we are using even less. So as soon as your occlusion is there, you fire it for a second and it's done. You saw in the beginning, since this video started, we had done many surgeries already. But look at that, EPT is only 57% per second. So even with such a hard black nucleus, our phaco power is just 35, because we are using the vacuum to hold it effectively, and we are using the advantage of low aspiration to go down quickly. Now this is all done. Now we have come to the quadrant removal. You can see the quadrant removal here. The settings have changed, and we are using a vacuum which is linear now, because we don't want too much vacuum. We want aspiration to be fast. So aspiration we have fixed. And here, as you can see, if the things happen slowly, you can shift to a fast fixed vacuum also and fixed flow rate, because there's a very good surge suppression within the thing, and this is the epinucleus mode. But again, the parameters have come down. We have used a lower flow rate. So as you progress in your surgery, you bring down your parameters. That is the most important thing, and that's what you're supposed to do. And the rest of the thing just progresses as it is. So the rest is just a simple lens implantation. That's it. So thank you, ladies and gentlemen. And if there are any questions, please do ask me. Or are there no questions at all? Well, thank you so much.
Thank you. Thank you so much to all the audience for the trust, and I thank you so much to our great experts for their lovely inputs and contributions. Does anybody have any questions for the panelists? Is the next session, people are already there? Yeah. Thank you so much. Thank you. Let's have a photograph, please.